Hello. As we've seen from our previous episodes, the menstrual cycle varies from woman to woman, and it comes about as a result of hormones that regulate the cycle. So, in this video today, I'll be talking about things you should look out for if you see it happening during your period, or things you should never ever ignore. Hi there, I'm Dr. Ayuk. I'm a medical doctor and I do medical educational videos. So, the first thing to look out for is heavy bleeding. What I mean by that is, if your period has been regular and you're bleeding, the amount of blood you pass out just suddenly becomes more in quantity, okay? Heavy bleeding just simply means if your pad gets excessively soaked within 1 or 2 hours of you putting it on, or if you bleed with clots that are as big as the size of a coin, or at night you change more than one pad, then that is classified as heavy bleeding. So if you had your bleeding that was normal, then it just suddenly changed into it being so heavy, then it's something to look out for, because there are conditions that can cause that to occur. One of them is fibroids. Fibroids are just growths in the womb of ladies, and the growths are non-cancerous. That means it is not due to cancer. So when we have these growths in our wombs, they tend to make our periods to become very, very heavy. And if you are having that, I think you should really check out with your doctor. All right, so the second point that we'll be looking at is, like we saw in our video, the normal menstrual cycle is 21 to 35 days. Anything outside of that, that is if your cycle is too short, or that's if you have cycles before every 21 days, or your cycles comes after every 35 days, then it's something that you really need to put an eye on. Why? Because there are conditions such as polycystic ovarian syndrome, but don't be bothered by the big name. So polycystic ovarian syndrome is just a condition in which there is fluid in sacs, right? Fluid forms in sacs in your ovaries. So they tend to make your hormones, they disrupt your hormones, thereby disrupting your cycle and making it to be more longer. Okay, so that could be one of the reasons why you are having these longer cycles, all right? Or it could be as a result of maybe early menopause. Early menopause is something in which you are a young girl, maybe 35, 36, 37, 38, then, or even younger than that, then you just start seeing, missing your periods, okay? You miss your periods, or your periods become extremely longer. That's just as a result of your hormones not really balanced. Okay, so if you have any of these, then you should check with your doctor. Okay, so this brings us to the third point, which is bleeding in between your periods. That is called intermenstrual bleeding. I'll explain this. This is if you have between 2 consecutive periods, then you see spotting or bleeding. Some people say bleeding after every 2 weeks, or some people say you can bleed anytime. That means you had your period, you bled for maybe 3 to 7 days, and it was finished, then maybe in the next week you start seeing another bleeding, maybe spotting, then it should be something that you should really check out for, because there are certain conditions, like we've seen, when you have cysts in your ovaries, it can cause that to happen, as well as also too, if you have fibroids, you can also bleed between your periods. But also too, it could be a sign of cervical cancer in women. So if you have that going on with you, I would highly recommend that you check with your doctor to make sure everything is okay. All right, this isn't actually a point, but I'm just going to add it because I talked about intermenstrual bleeding. Also too, if you realize that after intercourse, sexual intercourse, you bleed, or you see blood, or you spot, okay, it could be many things, right? It could be as a result of maybe the activity was vigorous or rough, so it caused or you were not well lubricated, so it caused the bleeding. But if you were well lubricated and everything was normal, and you realize that you bleed during that process, and also to you feel so much pain, that should be something you should check out with your doctor, because it could be a sign of maybe cancer of your cervix as well, or not really, or changes in your cervix. It would be good if you really check that out with your doctor. Okay, the fourth point that we'll be looking at is if the days in which you bleed. Normally the average days in which you bleed is 2 to 7 days. Okay, so anything outside of this should warrant you to investigate further by seeking medical attention. If you realize that you're bleeding for long, maybe 8 days, more than a week, then you should really check that out, because it could be something ongoing that your doctor needs to correct. Now, so the fifth thing to look out for is if you have cramps, that's abdominal cramps during your period. Firstly, it is very normal to have these cramps during your period, but if they become so intense and so painful, then it is something that you should look out for. Why I say it's very normal is the fact that during our periods, the uterus is contracting. Sorry, the womb. Uterus is womb. The womb is contracting to expel your period out. So the body produces a substance called prostaglandin. It is this substance that brings about this pain. But if you start noticing that your cramps are really unbearable and very severe, it could be something known as endometriosis. That simply means retrograde menstruation. That is, instead, some of the periods is coming out down below, but some instead goes to other parts of the body, that is upwards. We can have others in your womb, others in your ovaries, others in your tubes, and also maybe in your intestines as well. So that could be the cause for your very severe cramping. Also too, there is another condition. It is called adenomycosis. Don't bother about all those names. And also it could be as a result of uterine fibroids as well, causing that excessive pain. So if you've been having this and they are really unbearable, it will do no harm if you check out with your healthcare practitioner. Okay, so this takes us to the sixth point, which is missed periods. Like we all know, when I'm a doctor, I see people coming in and say, oh doctor, my period, I miss my period, I've not been seeing my period for a while now. And the first thing you ask them is, have you tried taking a pregnancy test? And they'll be like, oh really? Yeah. So what I'm saying is, the first thing when you have your missed periods, if you've not seen your periods for a while, obviously as a woman, the first thing you should do is to do a pregnancy test. And if it is negative, then we need to look for the other causes that could be causing that. So one of it that we've seen already, it's called early menopause. It is just when your body doesn't produce enough of the hormones, so you tend not to have your periods anymore as a young lady. Go to the hospital. That is totally treatable. They'll put you on hormones where it is going to regulate your cycle, and your cycle will return back if you're a young lady. But if you are towards the age of menopause, maybe 51, 40, maybe 45, then that's fine. But if you're below and you just have this sudden stoppage, then it's something to check out about. Okay. And also too, it could be as a result of fibroids. Fibroids is everywhere. So since we've talked about menopause, let me dive in now to the last point. So if this is for our moms, our aunties that have already attained menopause, if your menses has stopped, you're in your menopause, and then out of a sudden you start seeing spotting, or that's bleeding from down below, don't think it's your menses that has come back, because it's normally when you've arrived at menopause, it doesn't go back. So if you have that, then me as a doctor, I'll be really, really worried, okay, about that, because it could just be a sign of something very serious happening. It could be cancer of your womb, or it could be cervical cancer as well. So if you have your moms, your aunties who have attained menopause, and they start having those spotting, then you should advise them to see the doctor immediately to rule out what we just mentioned. Thank you so very much for watching this video. I'll be doing another video on other signs too, because I couldn't exhaust it. This was really getting too long, so I decided to cut it at this point. So I'll be doing another video on other signs that you have to check out for. Also too, if you're wondering how to calculate your cycle, we've already done a video about that. And also too, how to care for vaginal care as well, to avoid sexually transmitted infections, urinary tract infections, and even cervical cancer. We've done that video already. Okay, so you might want to have a watch. All right, so if you found this video interesting, just give us a like, and comment if you have any worry or any concerns, then I'll be addressing them. If you want me to do a video on anything, I've been having some requests which I'll be putting over and doing. But if you want me to do a video on anything particular, then just write it in the comment section and I'll be doing that for you. Thank you so much. Hope you stay safe and be good.